Next up, we have Jhilam Biswas, virtual.
Good afternoon, Chair Vilas and Dom and members of the committee. Thank you for the opportunity to testify on the House Bill 2210 and Senate Bill 1401, an act to provide more timely treatment of inpatient mental health care. My name is Jhilam Biswas. I'm the president of the Massachusetts Psychiatric Society. I represent about 1,500 psychiatrists in the Commonwealth, and I am testifying on behalf of the Society's strong support of this bill. I'm also a forensic psychiatrist. I'm the director of the Psychiatry Law and Society program at Brigham and Women's Hospital, and I treat patients at that hospital and teach at Harvard Medical School. I've authored some Boston Globe opinions on this issue, as well as multiple research papers that I will be submitting in written testimony. And one of those op-eds are called Massachusetts Law Meant to Protect People with Mental Illness May Make Them Sicker, talking about this Rogers guardianship in today's legislation. From both my clinical and research experience, I have seen how this adversarial hearing process in the Commonwealth, called the Rogers guardianship, significantly delays medical treatment for patients during acute psychosis, often prolonging suffering and long hospital stays. I trained at Harvard, UMass, and Worcester Recovery Center and Hospital, and then later worked at Bridgewater State Hospital from 2015 to 2021. During that time, I evaluated and treated more than 1,000 patients across all of those units. What became clear to me was that timely treatment is the single most effective way to reduce violence and incarceration among people with serious mental illness, and also improve their health, their comorbidities, and likelihood of relapse. Frustrated in all the delays of care I saw clinically, I conducted the first ever IRB-approved study at Bridgewater, examining patients with Rogers guardianship. Our team tracked 300 court medication petitions. We found that on average, the patients waited 41 days for medication for treatment due to this adversarial hearing process, and I think this is unacceptable. When hearings occurred, the judges agreed at the hearing with the hospital physician 99.1% of the time, showing that these delays offer little benefit. Once the treatment began, all adverse events, including assaults to patient and staff, self-harm, threats, and psychotic distress, dropped significantly. These findings are now published in a peer-reviewed medical journal, which I will submit for the record. Since then, I've worked with different teams looking at an academic civil inpatient psychiatric hospital, Brigham and Women's. Our preliminary results there show that each day of delay of the Rogers hearing increases the psychiatric hospital stay, and the treatment itself decreases adverse events. All I want to say is that being started on the right medication improves the mental health of the patient. It reduces workplace violence. It boosts staff morale, improves retention, and helps dedicated professionals, nurses, social workers, and others feel safe providing compassionate care.
Thank you very much.
And I truly hope we support this bill.
Thank you very much for your testimony today, and we appreciate you being so patient here testifying. Questions, members of the committee? Seeing none, thank you very much. Next up, Rohn Friedman, virtually.
Thank you very much. I'm Rohn Friedman. I'm the Vice Chair of Psychiatry at Beth Israel Deaconess Medical Center, and I'm speaking on behalf of the Massachusetts Psychiatric Society and the Massachusetts Health and Hospital Association relative to H2210 S1401. We all share the goals of providing effective, evidence-based mental health treatment to those who suffer from serious mental illness and protecting their right to make informed medical decisions. The goal of this legislation, as we've tried to make clear, is to expedite the 8B process that balances those goals, not to eliminate it. What I wanted to speak to were some of the impacts of what happens on an inpatient psychiatric unit with a patient with an acute exacerbation of a psychotic illness who's admitted but continues to refuse antipsychotic treatment. Nothing I can say can compare with what the families of patients report in terms of the distress and the cost to the patient himself or herself who is struggling with delusions or hallucinations, which can be terrifying. We also know that there's a correlation between the length of untreated psychotic illness and poorer neuropsychiatric outcomes, as a number of speakers have pointed out. Our staff are trained in de-escalation techniques, but these do not always succeed in the midst of acute psychosis. While awaiting 8B hearings, one recent patient had 5 seclusion and restraint events. Another had one event where he punched a patient in the head and face, another where he punched and bit public safety officers during restraint. In those settings, for those who may not understand or have experienced this, we may give a single dose of medication as a restraint, but I would underline that that's very different from using medication as a treatment for illness. It's a single dose of medication used largely for sedating properties, not an ongoing course of treatment. We can't treat the underlying illness, even though the behaviors are due to that underlying illness. I'm going to skip over some of my other comments as I see time is progressing, to just point out that in addition to the injury to patients and their families, the physical injuries, the emotional injuries, the staff too suffered not only physical injuries, but the moral injury of being turned by this process into jailers, where we could administer restraints, but we're not allowed to administer treatment and follow our patients in this escalating, alternating cycle of having to wait for an explosion, giving them a single dose of medication really as a restraint, not as treatment, and then waiting for the next explosion while we're waiting for a court hearing. Thank you, and I'd be happy for any questions.
Thank you so much for your testimony. I hope you'll submit what you didn't get to say in writing to the committee so that we can benefit from it. Are there any questions from the committee? Thank you so much, and thanks for your patience in testifying today.